It's Mark from Top Local. I'm here with Simon Kelly of Insync Physio in Vancouver. They're award-winning physiotherapists, multi-time award-winning best physiotherapists in Vancouver as voted by their customers. And we're going to talk about knee pain from kneeling. How are you doing today, Simon?
How are you doing, Mark? Thanks for dialing in, sir. Doing really good today. So, yeah, we're just going to talk a little bit about kneeling pains. The umbrella term we use is patellofemoral pain syndrome, PFPS for short. Like you so rightly said, a lot of people get pain when they kneel directly on the knee from direct compression of the kneecap against the femur. Someone like a tiler or someone who's working on their knees a lot in their job or their occupation. Other times people have it going up and down stairs, particularly on the way down actually, because it loads that joint more. Coming down the grouse grind or any of the hikes we have here around Vancouver especially would be sore. Generally it's more gradual in onset, not a very specific event, and then you get a lot of swelling and a lot of pain, and it just tends to get worse if you don't know exactly how to treat it.
So do you have a specific case example that you could kind of walk us through what the presenting problem looked like, what the treatment was, and then the result?
Absolutely, Mark. I had a guy come in, he was a 28-year-old. He was actually a mountain biker. So I think it was at the start of the COVID times, actually, just before I came in, he was doing a lot of mountain biking, and he said he went on a 7-hour mountain biking ride. And he started to feel a lot of discomfort in the knee. Now, mind you, 7 hours is a pretty long time, and that was a bit more than he was used to doing. So that could be part of the reason why his knee started to become sore. But also, we had to decipher what it was first. So like I said earlier, we look at the different diagnoses, the fact that it was non-specific. And what I mean by that is, his foot wasn't stuck in the ground and he changed direction. There wasn't a lot of swelling on presentation in clinic. Sometimes patellofemoral pain syndrome, you can have a minor bit of swelling. And he couldn't remember a specific event. This was what he was tying it to, the 7 hours of mountain biking. So for us, we have to build a picture off that. That kind of excludes or includes a lot of differential diagnosis, like I said. So he did say that the pain was sort of in behind the kneecap and a bit more to the inside of the kneecap, or the medial aspect, we'd say, of the knee. Usually when it's on the outside, you might have heard of ITB band or runner's pain. So that kind of excluded that just based off his subjective and what he was saying. So basically, when I actually asked him a few more questions, they're kind of intrinsic factors. And then we asked him about his bike and bike size and biomechanics of his bike. And he actually said that his suspension system, which is filled with air, I believe. I'm not an avid mountain biker, but he said that his saddle was quite low, which meant that the knee angle his kneecap was being forced off his femur a lot more on the ride than it usually would have been. So usually a higher saddle decreases the force of the kneecap. So I really feel that kind of factored in to why his knee really got aggravated on the mountain bike and on the way down especially. So that was kind of his initial presentation, I suppose.
And then what was the treatment course? What kind of torture did you put him through?
Yeah, exactly. Torture is right, Mark. So a lot of the time, like I spoke about there, there's intrinsic factors. So generally with patellofemoral pain syndrome, the structures on the outside of the knee, your outside quad and your ITB band that I spoke earlier are a lot tighter, especially in cyclists. So the inside knee is weak, which is the inside quad, called your VMO, and the outside is your lateral lateralis. So we kind of do a lot of soft tissue work down along the outside of the leg, and we do a lot of IMS, which is intramuscular stimulation. It's called dry needling because you're not actually injecting anything, it's just needling. So basically we do a lot of needling into the muscle called your tensor fascia lata. Now that joins onto the band that goes down outside of your leg and joins just below your knee. So a lot of the times those structures can become sort of short and tight. So the whole goal of the treatment is to needle the muscle on the top, deep soft tissue massage down the outside leg, and that will just release all the outside aspect of the knee. And then we strengthen the muscle on the inside of the leg. So this in theory will allow the kneecap to come more to the inside or towards your other knee. Because the kneecap travels in a groove in your femur. So in other words, you strengthen the inside of the knee, you roll out the outside of the knee, and then the kneecap travels. That's the intrinsic factors. The factors associated with this are kind of a knee in position. So if your knee is coming very close to the bar as you're cycling up and down, if the saddle is actually too low, like I spoke about earlier, that all increases the force of the kneecap on the back of the femur. So you can do all the treatment you want intrinsically, but you really have to fix the extrinsic factors for more longer term results and relief. That's why it's very important to take a good subjective examination. And that's kind of treatment that we would sort of do for him. And sorry, the exercises on the knee coming in, you generally, with a knee in position, you have weak hip, what we call external rotators or abductors. So keeping the knee away from the other knee. So a lot of strengthening exercises to get that knee in the correct biomechanical position, along with saddle height and cleat position. Even though he's a mountain biker, he probably wouldn't need cleat position. But they're all the kind of factors we have to factor in when we're dealing with a client like this.
And so what kind of result? What was the prognosis and how did it work out for this client?
Absolutely, Mark. Yeah. So when he first arrived in, I forgot to mention it actually, you know, he was feeling pain after 10 or 15 minutes mountain biking up. And so by the time I finished with him a couple of weeks ago, he was up to like 3 or 4 hours again, pain free. So I think most of it, like I said, it's a combination. He definitely had tight outside structures or lateral structures. We eased off all that. We strengthened the inside of his leg. I spoke to him all about the biomechanics and exactly how his knee can go up and down. So he was very, very pleased. He had no pain, obviously. And obviously, initially, you have to get rid of some of the aggravating factors, like avoiding kneeling on his knee. Sometimes even seated positions can push the kneecap away. So he was doing a lot of sitting at a desk job as well. So when it's very, very irritated, that can even be painful without direct compression, like kneeling on the knee, like I spoke about. And avoiding deep positions of the knee, like deep squats, they were all implemented. So we got him back to pain free, but obviously he wasn't back mountain biking. So by the end of it, we just increased gradually, fixed his saddle height, fixed his foot position, and then he gradually got better and better till he was up to 3 or 4 hours. So he was very, very pleased with the outcome, as was I.
Great. So if you have some knee pain, that you need expert diagnosis and then a proper training program that will relieve the pain for good and the knowledge for yourself so that you know how to prevent it in the future, because these things can go on for a long time. I can speak from experience on this. Insync Physio, you can get a hold of Simon Kelly at the Cambie St office, which is at 604-566-9716. Or check out insyncphysio.com. You can book online there. It's very simple, very easy to use. Or if you're in North Burnaby, they have a Burnaby location. You can reach them at 604-298-4878. Again, you can book online at insyncphysio.com. Thanks, Simon.
Cheers, Mark. Thanks very much.